Hello, I'm Eric Topol for Medicine the Machine with my co-host, Dr. Abraham Verghese. And today is a very special and remarkably coincident day because we have Dr. Rachel Pearson with us, and it's a day that the FDA is just about to approve vaccinations for age 5 to 11 children. And so this it comes at a propitious time because Dr. Pearson is a physician, scientist, author who is at the Center for Humanities and Ethics, a pediatrician on the faculty at the University of Texas, San Antonio Long School of Medicine. So an amazing background, an amazing author. You may have know her book from 2017, No Apparent Distress. And she has written many pieces in recent months in places like the New Yorker and the Washington Post, and many others, actually. It's hard to keep up. She is a gifted writer, an extraordinary pediatrician, and I would say humanitarian. So welcome, Rachel.
Well, thank you so much. It's just an absolute pleasure to be here.
I didn't realize that Abraham and you have some common threads, so I'm going to turn it right over to Abraham to go over that.
Yeah, it's such a delight to get to talk to Rachel because Eric, as you might remember, I ran the Center for Medical Humanities from 2002 to 7. In fact, I was the founding director and had the great pleasure of seeing that grow. I didn't get to meet Rachel because she came after my time, but I've been hearing so much about you, Rachel, that it's truly a great honor and privilege to read your writing and then to meet you this way in person, so to speak. So welcome to our program, and we look forward to hearing from you.
Well, thank you so much. And yeah, I've been reading your writing since I was a pre-med, and I have just such respect for the work that you do in the world, and definitely to get to follow in your footsteps at the Center for Medical Humanities and Ethics is amazing. Someday I hope I'll be the writer that you were.
Oh, you already are. No worries. We have so much to talk to you about. I'm going to let Eric lead off here.
Well, maybe, Rachel, we can start. You've obviously put much thinking into the whole children and COVID narrative. You have, I think, a young child, so you have primary experience. Why don't you just kind of free range start off? What have you been thinking about lately on this?
Yeah. So you're right. My son, Sam, turned 15 months today. So he's one of the little Americans who's not yet eligible for the COVID vaccine. And since becoming a mother, my practice as a pediatrician has interpolated so much through my love and my care for him. It's brought me a lot closer to the concerns of other parents. Lots of great pediatricians don't have kids. And, before I had a kid, I used to say, I only like kids when they're seriously or critically ill. But that's not true. I'm delighted to have my own. When it comes to COVID, kids have been spared from a lot of the severe effects of infection itself, largely speaking. I think public health has really tried to strike a balance between reassuring parents that any individual child is unlikely to suffer severe illness or die from COVID, and at the same time, keeping in people's minds and in the minds of physicians and school officials that some kids do. I mean, some kids do get really sick from COVID. More than 600 kids in this country have died from COVID. And so to be now on the threshold of another large group of children becoming eligible for the vaccine is an incredibly exciting moment. A lot of what I'm thinking about lately is, how do we harness this potential? How do we work with our communities? How do we work with the families we care for to ensure that the kids really can benefit from this vaccine, and the families who can really benefit from their kids getting vaccinated are able to reap that benefit? I think a lot of it is going to come down to effective communication on our parts.
Rachel, you live in a very progressive city, but in a state that, to many people outside the state embodies the resistance to to the vaccine, to science, and you've had to walk a sort of a fine line. But also, I think you've been approaching this wonderfully in terms of trying to really understand what the people who are resistant to this are thinking. Tell us a little bit about your strategy in conversing with mothers about the vaccine and its the need for it and so on.
Yeah. So yes, I'm in the great state of Texas, where I'm from. I'm a fifth generation Texan on my father's side, so I'm very emotionally embedded in this place. And I think that there is a little bit of a breach between the popular perception of vaccine hesitant people and then what you actually encounter, in the hospital or in your office as a pediatrician. If you look at social media, it would make you imagine that most unvaccinated people or vaccine hesitant people are conspiracy theorists who believe that the vaccine will magnetize you. And what I actually experience the vast majority of the time is parents who have concerns about the vaccine and are trying to make the best choice for their specific child. That's not to say that the political milieu in Texas and in other states that have actively resisted sensible public health measures doesn't make a difference. It does. It makes a huge difference when your governor is opposing masking, when your governor isn't allowing local officials and school officials to make reasonable, safe health decisions for our communities. That really leaves parents in a hard situation because they feel like all the responsibility is on them to protect their kids from COVID, when in fact, to protect anyone from an infectious disease, we need the effort of, individuals, families, community organizations, health systems. We truly are all in this together, as y'all know.
Well, I wonder if you could expound about this decision that parents will be confronting. They already have for teenagers, and they will be shortly, within days, for age 5 to 11. The issue is we know the risk, as you've already mentioned, for death or hospitalizations are relatively low. They still occur. But what seems to have been missed largely is not just the long COVID story, which we know does occur in children and teens, not at the same likelihood as with adults, but certainly it does occur. But also the transmission chain. That is, how are we ever going to get over this virus or get on top of it if we don't get the vast majority of the population? So then on the other hand, this risk, well, in the teens, the main issue of concern has been myocarditis, which we know is usually, if it occurs, it's rare, but it's mild. It isn't usually something that is of serious nature, but it has given a lot of concern to parents of teens. And then we don't know, we have these two trials from Pfizer and Moderna of 2,000 to 4,000 people. It's not 50,000 people, participants in the children. And so a lot of people out there, parents will say, well, there's just not enough. We don't know. So how do you give us the balance of the risk benefit to provide the confidence factor for parents?
Yes. Well, that's such a great question because it's true. When I, as a physician mom, think about, do I want to expose my toddler to the COVID vaccine or do I want to expose him to COVID? Those feel like the choices if he remains unvaccinated, given the high prevalence of infection. I absolutely hope that he is vaccinated before he is ever infected. And that's because, as you say, long COVID is not as common in kids as it is in adults. But for small children, subtle symptoms can be really hard to pick up on. And we won't know for years if there are developmental effects of COVID infection in the preschool, in the preschool years or infancy. It's going to take us a long time to get that data. The the thing about vaccines is, lots of parents are worried about the vaccines somehow having a delayed long-term effect. So they think that, you're going to get the vaccine and then 10 years later, something's going to pop up and we're all going to regret having vaccinated our kids for COVID. But that's just not something that we see with vaccines. There's no reason to expect that will happen with vaccines. There's no reason to expect that will happen with the COVID vaccine based on our decades and decades of experience. I also think, as a pediatrician, post-viral infectious neurological problems are something that we see pretty commonly in the hospital setting. I care for kids who get acute disseminated encephalomyelitis, likely related to a previous viral infection. Kids who have post-infectious arthritis, post-infectious symptoms from viruses. We don't see very much of that from vaccines. And so do I think, do I want my kid to get, a single, very specific, vaccine generated antibody that will protect him? Or do I want him to have a natural infection and develop a whole panoply of antibodies that may or may not have effects in the long term? So I think to build confidence, we need to focus on kids and families' reasons to get the vaccine, right? So get to the reason why you want it. If you're talking to a teenager, what is it that you think the vaccine would help you be able to do? And kids care about stuff like not having to stay home from school in quarantine, being able to play on their sports teams, being able to go to those big family gatherings without worrying. Kids really being engaged in the world. And they are often willing to take a step to protect other people, whether that's masking or vaccinating. So I think part of it is really focusing on the potential benefits of vaccination. And then when it comes to risks like myocarditis, I think parents need to know that we take those seriously. I agree with you. My interpretation of the data is absolutely that myocarditis from an mRNA vaccine is an extremely rare event. And it's usually quite treatable with NSAIDs. We do need more data following the kids who do get myocarditis over time. And we will be getting that data. But parents need to know that if they bring up that risk, they need to know that we are taking it seriously and that we're glad we know that it's out there. And that way we can be keeping an eye on their kid.
There's actually some data out there, and I only know this because I keep up with Eric's Twitter, to show us that the risk of myocarditis with natural infection is also pretty significant and probably more than the risk from the vaccine, which I think is also a useful argument. I must say that you've been very brave about speaking out about, many causes many things that you believe in. And I imagine that you get flack from time to time, but this is really a hot button issue. And I want to ask how you've been able to weather the storm of pushback. I imagine there's been pushback. We don't necessarily see all that, but I could predict that. How has it been?
That's such a generous question, Abraham. Thank you for asking me about that. And I will say that I look to the physician advocates I admire, and Dr. Eric Topol is one of them. People who consistently put their voices into the public sphere and stand up for what matters for families. So, I try to take the example of the leaders who, from the outside, it looks like, the flak just rolls off your back, like water off a duck's back. I can't imagine that there's not some emotional toll that it takes, though. After my most recent Washington Post article on talking with parents about the COVID vaccine, I actually got off Twitter for a few days just after getting a lot of sort of negative messages and things from anti-vaxxers. And what keeps me in the conversation is just the sense that it's my, the word in Spanish is papel. It's my papel, like it's my role as a writer who is a pediatrician who has access to the platforms I have access to, and who is trying to write from Texas in a way that confers the right amount of dignity and humanity on poor and working class Texans, the families I care for. I'm not a person who ought to back out of the public discourse, even though it does get very uncomfortable. I'm actually kind of shy by nature. There's a reason I'm a writer and not a TV personality. I like the solitary work of writing, but in this day and age, that means engaging with the public in a pretty rapid fire way.
Well, just on that note, I learned yesterday that the VRBPAC group that reviewed the advisory committee for the pediatric vaccine, Pfizer, a neo-Nazi website put on all their addresses, their phone numbers, and and bombarded each of them with threats over the past week since this advisory committee occurred. So we're in a very serious time of anti-vaxxing, anti-science, acknowledging your very important point earlier, Rachel, about how most of the people out there who are deliberating are not in that group, but this small, vociferous and really sick disinformation campaign that are attacking ad hominem people. It's unimaginable, unthinkable.
Medicine and the Machine will be right back.
Welcome to Medscape's latest podcast series, Medicine and the Machine, featuring Medscape's editor-in-chief, Dr. Eric Topol, and master storyteller and clinician, Dr. Abraham Verghese. Remember, you can find the latest in medical news, expert perspectives, clinical tools, continuing medical education, and more at medscape.com.
Now, I'm really curious about you as a writer. You mentioned it. You mentioned also that when you were pre-med, as if that was a long time ago. You're so young. Oh my gosh, you're so young. We're the old farts. You're the young person. So tell us about what got you into writing, because you already wrote a book, I think, as a medical student or a resident. You wrote your first book, which I know there'll be several, of course, but how did you get into, and you basically found a niche of talent that adds on to your background. It's extraordinary.
Oh, thank you for that. Such a kind question. I have always been a writer since I was 6 years old, and I published my first story in the newspaper.
Wow!
I still have the clipping of. Writing has always been my best way of thinking and reasoning about the world. And when I write, I feel calm. I actually set out to be a professional writer. After undergrad, I started a master's in fine arts in creative writing at Columbia. And just by chance, the summer before I left for Columbia, I had a job as a patient advocate at Whole Women's Health, which is a clinic in Austin. It's a women's health clinic that also provides abortions and has been in the news a lot lately. That job, which I happened to get because it was well remunerated, basically, for a college grad without any relevant experience. That job introduced me to healthcare, and I found that hearing the stories of women in the clinic space was so profound and interesting. I mean, in the clinical space, people tell you stuff they have never told anyone. And if you're able to listen in a compassionate way, you're invited into someone's life and story in a way, I mean, Abraham writes about this all the time, but in a way that is deeply special. And after having been in that clinical space, the life I could see for myself as a writer of fiction stopped making sense. I'm from a very small town in Texas. My father's a carpenter, my brother's a commercial fisherman, my mom's a teacher. And I also wanted to do something that felt concrete and meaningful in the way that their work does. And so I was drawn into medicine. And I initially thought, oh, I'm an artist, I'm not going to write about medicine. But again, those stories kept bringing me back every single time. The stories that we hear, the situations our patients find themselves in, and the way that we have a lens on how injustice affects the body. It became impossible to not write about medicine. And so I've been very lucky to be able to bring the two together. And I do feel like I'm doing the work I'm supposed to be doing in the world.
Mm.
You were very fortunate to also, I think, attend UTMB in Galveston, which is the oldest medical school in Texas, but also, I mean, long before medical humanities programs became almost commonplace at medical schools, they were the first institute for medical humanities. And I remember looking to them, and looking to their history as we started something at San Antonio. Talk a little bit about that tradition of medical humanities that really, I think Galveston put that on the map in many ways, you could argue. And your PhD is from there, or yes, if I remember right.
That's correct. Yes. So I became an MD PhD because I had discovered that the medical humanities existed. It seemed quite obvious that those were my people, and I needed to go be with them. And the way to do that was to get a PhD along with my MD. But the Institute for the Medical Humanities is a truly special place. At the time that I was there, most of the faculty were PhD scholars in humanities disciplines. So philosophers, historians, social scientists, people who had dedicated their lives to considering problems in medicine through these rigorous means of reasoning in the tradition of the humanities, which y'all know. The humanities as a set of modes of reasoning predates the scientific method by thousands of years. So basically, the Institute for the Medical Humanities is where I got woke. And also it gave me the tools to interrogate my own education and training, to interrogate the systems affecting our patients, and to really try to build a moral foundation for my own work and contribute to the moral foundation of our profession. It was and it still is a really special place.
Mm. In your book, No Apparent Distress, you focused on the underrepresented, which was a precursor to what has been happening, of course, in the pandemic. Can you tell us a bit more about what that was, your own personal experiences that led to that book, what it was all about?
Sure. So the book focuses on a free clinic in Galveston called St. Vincent's, where I trained as a medical student. And at the time that I started med school in 2009. And so if y'all recall, that's when the Affordable Care Act began. It was being debated. We were all looking forward to its implementation. We genuinely thought that the need for free clinics was going to go away because everyone is going to have access to funded medical care. I know. And then over the years that I was there, we saw how, the Affordable Care Act was eroded. Medicaid expansion was not made universal. Texas did not expand Medicaid. And so even today, 11% of Texas kids lack access to medical care. And I think it's like 19% of Texan adults. It might be around 20%. But we haven't seen the advances we had hoped for from that legislation. And so what that meant on the ground was that at the free clinic, we could diagnose people with complex processes, because at a free clinic, you can do something like get a biopsy, and we would get a pathologist to read it. And in many cases, we would diagnose cancer. We would diagnose endometrial cancer. We diagnose some head and neck cancers. But at a free clinic, you cannot give chemotherapy. You certainly can't do surgery. And so we were often diagnosing people with serious problems, but found ourselves unable to secure access through my same university, through the hospitals in Houston. And we watched people deteriorate and in some cases die of conditions that we knew were treatable if they were funded. That was very personal for me, of course, because I'm a Texan, these are my neighbors, but also, my family has people who are uninsured. I grew up with, imperfect access to insurance coverage myself. And so it was people I really recognized on a really intimate level. And that was a formative experience for me, both as a physician, because I had to recognize myself as involved in a system that was allowing poor people to die of treatable conditions. At the free clinic, I learned so much. I benefited so much from being able to work with those families. And with my education being funded by the state of Texas, I was in many ways a beneficiary of those same systems that were allowing patients I loved to suffer. So that moral question of how do we speak within, how do we become agents for justice within an unjust system that we may be beneficiaries of, animates a lot of my work to this day. I never try to position myself as the good doctor or the person who has it all figured out. I'm always somebody who's caught up herself and trying to do her best.
It's remarkable what you've already accomplished. What are your plans looking ahead? Where do you see yourself taking this? I mean, I hope you'll continue to be such a wonderful public advocate for, common sense and public health. But do you have any future plans that you'd like to share with us?
Oh, well, I'm starting my third year here at the Center for Medical Humanities and Ethics and at UT Health San Antonio. So I feel like I'm beginning to learn how to be a good attending. I'm beginning to get my feet under me. Right now, I think I'm in the right place. I mean, San Antonio is Abraham is such a beautiful, diverse city. It's a city that welcomes immigrants, and a city whose spirit is really animated by working class people supporting each other. So I feel like here I'm able to do the work that I ought to be doing, especially as a bilingual pediatrician. I would hope to write beautifully about the issues facing Texans. I mean, if I have a body of work in my life when it comes to the writing, I hope that overall it reflects the complexity, the intelligence, the dignity, and the humanity of ordinary Texans, of ordinary people who are struggling to live their lives. And so I have a real vision for the writing work, and then for what comes next in terms of advocacy and in terms of my clinical life, well, we'll have to see.
I have a friend who was a banker in Texas, and he always used to use expression when talking about people having very different opinions or even conflict, was that you have to bring them along. And it seems to me that, that's what you have to do, is you have to bring people along patiently and, with the same reasonable tone that you've been using. And so I think you're onto something. Just keep bringing them along.
I was going to make a prediction. So a friend of mine, Abraham Verghese, actually back 5 years ago, was at the White House, recognized by President Obama for the National Humanities Medal for his work. And my prediction, even though I know that's not your motivation at all, is that you're going to follow Dr. Verghese's footsteps. I really think you have the talent. You're an extraordinary person. We're very lucky to have this time with you today. And, it doesn't, a little boy on the street could predict this one. This is really impressive, what you've already done in a very short span of your career, Rachel. So thank you so much for joining us. Your writing inspires us. I mean, when I read your Washington Post opinion, that's what I said. I didn't know you, but I wanted to get to meet you. I wanted to know you. I wanted to read everything you've written. And now the New Yorker's figured out, who you are, and who knows what's next. So, we're lucky to have a physician author of your caliber. That's all I can say. I'll turn it over to you to wrap it up.
Well, Rachel, thank you. I couldn't really improve on Eric's words. I think you really have made me proud to have been associated with the Institute for Medical Humanities, and keep up the good work. I think you should take inspiration from Eric, my co-host. I think he never seems to think twice about what he has to say, as long as what he has to say is backed by reason and by science and by the good intentions that we have for the public that we serve. And that is our fiduciary responsibility, is to the public. And I think if you keep that in mind, then everything that comes with it is just no different than duty hours and long pay, long sort of obligations in the hospital. It's all part of the same coin, is how I see it. And we're very, very proud of you. Thank you for joining us. I'm sure that this is an episode our listeners will truly enjoy. So thanks again, Rachel.
Oh, thank you both so much. And truly thank you for all y'all are doing in the world, and for, the light and the truth that you bring to every conversation. So it's really been an honor.
Can you send me an email every time you publish something, so I make sure not to miss anything?
I would love to.
That would be great, because it's amazing stuff. And anybody who's listening, if you haven't been reading Dr. Pearson's writings, you're missing out. That's all I can say. It's really extraordinary. So thanks a lot. And we'll look forward to following your career with phenomenal interest.
Oh, thank you so much.
This podcast is intended for U.S. healthcare professionals.